Dear learners, in today's session we will learn about basics of health and sanitation. Third President of United States, Thomas Jefferson, in 1787 rightly quoted, "Without health there is no happiness, and attention to health then should take place of every other object." According to World Health Organization, health are a state of complete physical, mental and social well-being, and not just merely the absence of disease or infirmity. The enjoyment of highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion and political belief, economic or social condition. Healthy development of child is of basic importance. The ability to live harmoniously in every changing total environment is essential to such development. Sanitation word entered into the English language in 19th century. The term is linked with integrated water and sewer system. Sanitation is hygienic means of promoting sustainable health through prevention of human contact with hazards of waste. Hazards of waste can be physical, microbiological, biological or chemical agents of disease. Waste that can cause health problems are human and animal feces, solid waste, domestic waste water such as sewage, sewage and grey water, industrial waste, agricultural waste. These are all waste that can cause health problems. Globally, 1 in 3 people, that is 2.2 billion people, lack access to safely managed drinking water services, and 4.2 billion people lack safely managed sanitation services, according to UNICEF reports of 2019. Unsafe hygienic practices are widespread, compounding the effects on people's health. The impact on child mortality rate is devastating, with more than 2,97,000 children under 5 who die annually from diarrheal disease due to poor sanitation, poor hygiene or unsafe drinking water. Whether in cities or countryside, open defecation is most prevalent among the poorest citizens. This practice releases tons of feces daily into the environment. The risk of spreading diarrheal and waterborne disease is compounded by lack of regular hand washing and microbial contamination of water in their homes and communities. The situation contributed to nearly 1 lakh diarrheal deaths of children under 5 years of age in India. Poor sanitation can also have a ripple effect when it hinders national development, because workers are suffering from illness and living shorter lives, thereby producing and earning less and unable to afford education and stable futures for their children. Inadequate water, sanitation and hygiene services in India health facilities contributes to high neonatal mortality rate, which is currently 24 deaths per 1,000 live births. Sepsis, most spread in health facilities, contributes to 15% of overall neonatal mortality and 11% of maternal death. Now let us look into the health status in India. In India, about 9% of rural population and 12% of urban population reported ailments during a 15-day reference period. Proportion per thousand of ailing person was highest of the age group of 60 and above, which is followed by children. Around 96% of rural and 97% of urban ailing persons were administered some kind of treatment. Treatment without any medical advice are primarily attributed to financial constraint, which is 57% in rural population and 68% in urban population. More than 70% spells of ailments were treated in private sectors, which ranges from private doctors, nursing homes, private hospital, charitable institutions, etc. Both in rural and urban areas, highest proportion around 2.5% of hospitalization, which is excluding of childbirth, are reported for infection. These infections can be of fever, jaundice, tuberculosis, tetanus, diarrhea, dysentery or any other infection. In 2015, nearly half of the India population, which is 568 million people, suffered the indignity of defecting in field, forest, bodies of water or public spaces due to lack of access to toilets. India alone accounted for 90% of people in South Asia and half of the 1.2 billion people in world that defecated in open areas. Now the situation has improved. By 2019, the number of persons defecting in open in India has reduced significantly by an estimated 450 million peoples due to Government of India's flagship program such as Swachh Bharat Abhiyan, which is parallel with achieving the sustainable development goals. However, still we all need to ensure sustained use of toilets and hygiene practices by all and at all times. Challenges in healthcare system. Dr. Arvind Kasturi in 2018 identified 5 challenges in healthcare of India. These are awareness, access, absence, affordability and accountability. Let us understand each one of this. Lack of awareness due to low education status, poor functional literacy, low assent on education within the healthcare system and low priority for health in population are among others. Poor accessibility to good quality health system, we need to understand what are the barriers in access in terms of financial, geographic, social and system related domains. We have limited trained healthcare professional, which is an important challenge in healthcare. Private facilities are costly, while the public healthcare are low or no cost, but it is often perceived as a unreliable and compromising the quality, and generally it is not first choice unless one can afford the private care. Lack of accountability in procedures and responsibilities are another sector of challenge for healthcare. In India, life expectancy is 4 years below the world average, which is a matter of concern. High incidences of communicable disease, increasing incidence of non-communicable disease, neglect of women health, and considerable regional variation and threat from environmental degradation. More efforts are needed to fully eradicate a wide range of diseases and address different persistent and emerging health issues. By focusing on providing more efficient funding of health systems, improved sanitation and hygiene, and increased access to physicians, significant progress can be made in helping to save lives of millions. Currently, the world is facing global health crisis like other COVID-19. COVID-19 is spreading human sufferings, destabilizing the global economy, upending the life of billions of people around the globe. Before the pandemic, major progress was made in improving the health of millions of people. Significant strides were made in increasing life expectancy and reducing some of the common killers associated with child and maternal mortality. These are some of the important references which I have used for this presentation. Thank you and looking forward for your next session.